So wilderness medicine to me is the provision of providing medicine in a resource-limited environment, potentially under austere conditions. We have to go back to how we practiced medicine before we had CAT scans. We have to really examine the patient, take a history from the patient, if able, take a history from anyone nearby, and really look for physical signs and do what we can to stabilize the person in the field with the resources that we have. Does that usually end well? It depends on a lot of factors. Of course, depends on even if we're in the wilderness or in an environment where kind of our technology has been stripped. So when I talk about a resource-limited environment, this might also be in an urban area that's been hit with a natural disaster. So let's think about maybe Hurricane Katrina and what happened to the city of New Orleans several years ago. You have a flooded city and no infrastructure and no electricity, and patients still need to be taken care of. So you can consider that a wilderness environment at that point. And the most important thing for people who want to enjoy themselves in the wilderness is to be prepared for medical situations that might occur. For instance, many people enjoy the national parks now. And if you look at some of the data from Yosemite, about 28% in some research demonstrates that helicopter transports of people who are injured out of Yosemite were day hikers. So these are people who have injuries to extremities, like to an ankle, let's say, and can't walk, but they hiked into the park. Or these might be people who just overexerted themselves, might be too tired to get out. They have exhaustion. So the key to dealing with these injuries is to be prepared for them when you go in, meaning that if you're a casual day hiker, even if you're going out for a few days, you should really have a really adequate medical kit. There's no hard or fast defined kit. When we talk about a medical kit, we think about maybe a core kit, something with gloves, tape, bandages, maybe an ACE wrap, in case one does twist an ankle, to support that joint. Maybe some pain medication or allergy medication, like a base core kit. And then depending on the sort of environment that you're going out into, you're going to cater building upon that. For instance, if you are going to go into like a higher altitude environment and you might suffer from acute mountain sickness, which involves having a headache, you're going to want to make sure you have enough pain medication for more than one dose. Or if you're going to be out in a desert environment, you have to make sure you have sunblock or some medication to deal with maybe a sunburn. I would say generally no, and even people who are experienced. And I can tell you I've been on trips with people who are wilderness practitioners, and we are going up a mountain to go for a hike, and we sit there and we kind of chuckle going, oh, I can just see the headlines now. 4 physicians at a wilderness medicine conference stuck on a mountain, unprepared. And that's part of why I think wilderness medicine is becoming more popular and more of interest now, because people want to be out in wilderness environments. People are pushing themselves to experience new countries and new areas that hadn't before. Older people, a lot of retirees are the biggest demographic going out to wilderness areas. People are living longer and are healthier longer, but also have a lot of chronic medical conditions going out on safari or going into the backcountry, going on hikes. So it's really important that this medical knowledge is passed on to so many layers. I keep speaking of physicians or paramedics or nurses, but how about a wilderness guide? A wilderness guide needs to have some base medical knowledge. Let's say, for instance, what if someone has been bitten by an insect and has an asthma attack after being bitten or an allergic reaction? A wilderness guide should probably be trained in administering epinephrine or an EpiPen if that situation arises. It is imperative to get out of those wet clothes. So if this is, and obviously if we're talking about a warm weather type of summer trip, you might be okay because, with the heat, you'll evaporate. But kind of being wet and cold is the worst way to be, because you will never warm up, because once you start doing activities, try to warm your body, and your clothes are wet, some of that energy goes to drying your clothes rather than regulating your temperature. But then what happens is when you stop moving, when you stop doing activities, you just have this cold, wet layer on you. And that cold, wet layer is going to reduce your body temperature quicker than you being just exposed to cold air alone. So you should try to get those clothes dried as fast as possible, if you're able. This is when I go back to, what do you take with you if you're going out hiking? And there's certain basic things. I always feel the most important thing to take with you wherever you are is always your cell phone. So 3G coverage, 4G coverage is immense. Even if you can't talk to somebody, pinging off of towers works. Your location could be triangulated within a certain location. So take your cell phone with you. That's probably the greatest wilderness tool that anyone has. But number two is you always have to think about having to build an emergency shelter. And what do? People will tell you different things. You can bring a $3 foil blanket that you can buy from an outdoor store, or really a really heavy-duty trash bag, lawn and leaf bag, which is huge, works wonders. That is a lifesaver in a lot of respects. That could be used as a raincoat, but if you're stuck outside, you can make a little shelter with that, or frankly, you could just throw it on you as a vapor layer, and it prevents you from evaporating water, so you don't lose heat. It will also protect you from the elements, but it provides you, a type of shelter that you need. In your wilderness kit, you should have some ability to make fire. So whether you have a lighter or matches or, some other, there are other tools out there too. You should have something. Dry your clothes off, get into your trash bag and just wait until you can get those clothes back on. The biggest mistake, I think, is preparation before going out into wilderness environments. Obviously, people can't carry a huge, robust 30-pound medical kit that can cover every potential injury or illness that occurs. But part of the art of wilderness medicine is actually improvisations. It's being able to take the small amount of tools that you bring with you and be able to use them for multiple purposes. There is a tool out there, something called a SAM splint, which is a lightweight alumifoam splint. But this tool, weighs a few ounces. You can carry with you, but can be used to basically splint pretty much any joint. But also, let's say you're out in the wilderness and you fall and you have a neck injury, it can actually be used to support your neck. So outside of maybe a sprained wrist or broken wrist or a sprained ankle, it can be used to save your spinal cord as well.